Hi everyone, welcome to the class of Pediatrics Kids Recovery. Myself Dr. 𝗵𝗺𝗺, and the topic of discussion for today's video is short bowel syndrome. See, short bowel, as the name itself suggests, that the bowel is not as per required, and this is a short bowel syndrome. And what happens is that there is a malabsorption which is going to occur. Why there is a malabsorption? Because the required length of your intestine, of your gut, is not there. So because we have resected, extensive surgical resection of small intestine, okay, because of the extensive surgical resection of the small intestine, that is going to impair the digestion and the absorption. This leads to malabsorption syndrome. What are the conditions where we are going to resect the small intestine? Say, for example, if there is a small intestine atresia, if there is a small intestine volvulus, atresia means narrowing. If, for example, we have got volvulus, if we have got NEC, what is NEC? Necrotizing Enterocolitis, that means there is necrosis. Okay. If there is Hirschsprung disease, so we are going to resect the aganglionic part. Okay. If there is gastroschisis, okay, gastroschisis and 𝗵𝗵𝗶𝗵𝗵, some part of the bowel is outside the peritoneal cavity, so you have to resect it and anastomose the remaining ends. Okay. So these parts require the bowel resection. So what happens is, now there is no absorption, there is loss of absorption surface which is going to be there. So of course there will be nutritional issues, right? There will be metabolical issues, there will be infections which are going to be there. Okay. So these three things are important. Nutrition issues like deficiency of, for example, the iron deficiency is going to be there if the duodenum is involved. If this is jejunum is involved, of course carbs, proteins, fats, everything will be involved, and even the folate also, okay, B9. And then ileum, if it is involved, then of course vitamin B12 is involved. So can you see, jejunum, the proximal part, is having the B9, and ileum, that is the distal part, is going to have B12. Ileocecal valve, it actually prevents the bacterial overgrowth. Why? Because ileocecal valve is going to have its normal bacterial flora, which inhibits the growth of bad flora. Okay, so you got it. Now what are the clinical features? Because of course the absorption is not proper, the contents are going to go out, so there will be malabsorptive diarrhea, and because of diarrhea there will be dehydration that is going to happen. And since nothing is absorbed, everything is coming out, there will be vomiting, there will be bloating, and of course failure to thrive. And there is often a known history of prior bowel surgery which is associated with it. Now because nothing is getting absorbed, there is going to be bowel obstruction. There's going to be what? There's going to be bowel obstruction which is going to be there. Okay. And in USG, we have to check for the liver diseases also. Okay. Why? Because if you remember, I have told you that this ileum is responsible for B12, but it is also responsible for bile acids. Okay, for the absorption of bile acids. And since bile acids are not getting absorbed, not getting into circulation, they are going to get accumulated in the liver. And if the bile acids, bile salts are getting accumulated in the liver, that can cause liver problems. Okay. So what to do? I have told you that if any GIT condition is there, please hydrate the patient, please give a total parenteral nutrition, give antibiotics, give your PPIs for gastric acid hypersecretion, okay, and all these things you are supposed to do. But what happens as a problem is that sometimes liver failure and sepsis is going to occur, and this is the major cause of the death. Okay, got it? Great. Now this was about the short bowel syndrome. This is actually a very small topic, right? Yeah, short bowel syndrome, and I've tried to teach you. Okay. Now in this PDF you can see these both pictures, and kindly ignore them. They have been placed wrongly. Okay. This is a small rectification. I'm really sorry for that. All right. So thank you so much, and we'll meet you in the next class.